Hello and welcome to this podcast focusing on personnel wellbeing and managing stress for managers and leaders. My name's Therese Fitzpatrick and I'll be facilitating this discussion. I also have with me Daniela Milic, who's a HR policy officer at ICSC. I am the global lead for the UN System Workplace Mental Health and Wellbeing Strategy. We have two fantastic speakers with us this morning who I'll introduce in a moment. The reason why we're doing this podcast is we know that managers and leaders are essential if we're going to have a mentally healthy workplace within the UN. We also know managers and leaders are under a lot of pressure and stress at the moment. So we want to make sure you know how to take steps to look after your own health and wellbeing at this time. We also have some fact sheets that go along with this podcast, and they will be on our website, and I'll give you the details of that at the end. This is one of a series of podcasts and fact sheets, so we're going to be covering a whole range of different topics around mental health and managers and leaders. First of all, so now I would like to introduce our speakers. So we have Ruan Boshoff, who's the regional counsellor from UNICEF within Turkey, ICAR. And Daniela Menes, Staff Welfare Officer at ILO in Geneva. So welcome to you both and thank you for being with us today. As I mentioned earlier, Daniela will be the co-facilitator of this session. And apologies, we have two Danielas, so that be mindful of that. So the first question I have is for you, Daniela. So what are some of the common questions you hear from leaders and managers about self-care? What are their needs?
Hello to all, and thank you, Taras, for inviting me to be part of this podcast. Reflecting back on my experience with talking to managers and advising managers, I would say that there is increasing awareness of the importance of protecting and promoting staff mental health and well-being in the workplace. More and more managers do understand that everyone is vulnerable and that mental health needs more attention, both their own mental health and well-being and the one of the staff and the teams they do manage. Indeed, according to WHO figures, 1 person in 4 will be affected by a mental health disorder at some point in their lives. We also know from specialized literature that the line manager is one of the most influential factors on an employee well-being in the workplace. How managers set the tone about the importance of mental health and well-being, the attitudes and behaviors they exhibit and promote do impact on how staff struggling because of poor mental health or staff living with a mental health condition feel welcomed, supported, and looked after. However, despite this gradually increasing awareness of the importance of mental health and well-being I was referring to, when it comes to the practice of self-care, I often meet a certain level of attitudinal resistance. Meaning managers and staff alike do point out that by focusing on self-care exclusively, we may be missing the point if we do not simultaneously address the stressors and the pressures generated by organizational factors, such as work organization, work environment, managerial practices. All these factors, more commonly known as psychosocial risks. So indeed, managers might be and are in need of guidance and advice about self-care. But very often they are also keen on learning more about how could these individual efforts be sustained through the promotion of more structural organizational measures and practices. Again, based on my experience, the majority of managers I have been interacting with are interested in increasing their awareness of the correlation between good health, and that includes mental health, and high performance and effective productivity. Acquiring knowledge about the negative impact of unaddressed and unmanaged work-related stress on staff mental health and well-being. Learning more about how to identify and how to support a staff member struggling with a mental health issue. and also knowing what are the support services and mechanisms they could rely on for facilitating the access of staff to appropriate care. Another big challenge I come across when I talk to managers, and that's something that they raise, is that they struggle to maintain the right balance in between timely and effectively fulfilling the operational objectives set by the organization, while at the same time ensuring and maintaining good physical and mental health of staff. While this is particularly relevant and challenging for many managers and leaders in times of crisis, such as the current pandemic. All these considerations are clearly highlighting for me the complexity of the problem of mental health and well-being at work. And they indicate also that managers need to be supported and accompanied in their individual efforts to foster an enabling and respectful work environment that considers the mental health and well-being of staff and teams as one of the managerial priorities. I am personally convinced that with adequate support, managers could become drivers of culture change with respect to self-care and mutual care at the workplace.
Thank you, Daniela. There's some really great insights there around the role of that we can all take action to look after our own mental health. And I think that information about the workplace and the workforce and the way we work is critical in the way that we think about this. I'm interested, Ruan, do you have anything you would like to add to that?
Hi, Therese, and thank you for adding me as well to the podcast. It's a privilege to be here. I think Daniela really summed it up quite good. But if I can really just reflect on my interaction with staff and managers as well, I think especially during these recent times with COVID and so on, they find it really challenging to disengage and to actually break from work. There's this sense of responsibility. There's the sense of kind of emergency, and that we need to continuously be present and continuously check our work emails and so on. So I kind of see that kind of inability to unhook themselves from work responsibilities and so on is really quite present during these times. I just wanted to add that in.
Yeah. If I may also, Therese, in terms of issues that managers do raise with us, as Juan said, in the context of the current pandemic, issues related to managing exhaustion and fatigue, as well as dealing with sleep disturbances, are, I would say, the most commonly mentioned issues by managers. And of course, this support to managers with regard to such issues require, of course, individual discussions and require also a very contextual type of response.
And I think it shows how important it is for managers to be to really set the role and set the tone around this work. So I know for me in my department, there is a rule around no emails on the weekend unless it's an absolute emergency. And I know that really helps me to set the same tone within my team. So it's amazing that tone setting and making it really clear that it's okay to step away from work. And also I think as a manager, thinking about for their own team, everybody's got different needs at the moment, whether you're trying to look after children or whether you're living alone and struggling with that. I know one of the things I did was really worked out what was going to work for me at the moment in terms of the way that I work and discussing that with my manager. So I think it's critical that staff feel comfortable talking to their managers about how they can look after their own health and well-being. And then managers are open to those ideas, particularly at this time where our lives are so different than they were previously. So I think it's that double thing around setting a good example and then being really open to make sure that flows through to their team members and being open to how can we all support each other through this time.
I would agree with that, and would also add that probably flexibility is nowadays the key word in terms of managerial practices. Flexibility and in addition to care, mutual support, right? And I heard that, talking about my own organization, I heard that type of message coming from the top management. This encouragement and, as you said, setting the tone, if it comes from the top of the organization, I think it is going to have quite an effective impact on the way managers are managing their teams, but also in the way staff members feel actually that they are entitled to looking after themselves and being looked after by the organization and the management.
Excellent. So I'm going to turn to you, Daniela Milic. Do you have a question for our panelists today?
Thank you very much, Therese, and thank you to our distinguished speakers. This is very interesting and definitely highlights the need that we must prioritize employee mental health, but also mental health of the managers and leaders who are people as well. So the question I have for you, let me start with you, Ruan, is, what are some practical tips that you may have for leaders and managers about what they can do to help their team, their individuals in the team, and also function as a role model?
Thanks, Daniela. So when I first usually engage with a manager to talk about their own mental health, as well as the mental health and well-being of their team, I start the discussion around what is their current understanding of mental health and well-being. Stigma related to these topics have, in many instances, made it kind of a taboo to bring up, and often it just results in a performance issue that HR need to sort. So usually then, after creating that understanding of mental health, the conversation steers sometimes automatically into the direction of self-care as a leader. So here, like you rightfully stated, managers have to be role models. In team dynamics, there's often that concept of psychological mirroring, where the team takes on the stress, the anxiety, the motivation, and even sometimes the calm that a manager portrays. We know that successful leaders and managers globally take well-being, minimizing stress, and managing mental health really quite seriously in the workplace. That being said, I generally recommend starting with reflecting inward. Self-awareness is most probably one of the key drivers of positive change. Reflecting on your own mental health and hygiene is a good start. The key question here, for example, is to reflect on, if you look at that burnout continuum, where do you place yourself? So on the one hand, feeling energized, motivated, and ready for work, and on the other hand, feeling quite exhausted and overwhelmed, or maybe even numb. Once that self-awareness is there, it's also important to look at all the aspects of self-care. If we think about that, it's Lazarus and Kaufman, the transactional model of stress. Cumulative stress usually happens as a result of inadequate resources to deal with those stressors. Self-care is looking at, on the other hand, how can we build the capacity of our own inner resources to deal with stress? So, for example, setting healthy boundaries around your time with personal life, increasing activities that releases endorphins and get rid of those bad negative cortisol levels. This might include physical exercise, dancing, fun interactive games with the family, and whatever makes sense to you. Sometimes even having a talk with a staff counselor could prove quite useful in exploring new ways of taking care of yourself. There's a quote that I like from Katie Reed. She's a mental health activist, and she said, "Self-care is giving the world the best of you instead of what is left of you." I really like that. Now, coming to team mental health, again, I would say it's important to start with yourself. Have some introspection on what is your management style like. And you can ask yourself, does my management strategies actually include the capacity to integrate team mental health and well-being? It's really important then to look at what is the current status of your team members. Questions here that you can reflect on, for example, are, do you often see unnecessary interpersonal conflicts at work? Is there a trend of frequent absenteeism? Are there colleagues who disappear online? Another good approach is to look at their discretionary effort. So discretionary effort is essentially the amount of work that we do when no one is looking. With that, you can really look at, kind of on a percentage level, what is the or how intrinsically motivated are your team members? Once you have a good understanding of where your team is at collectively, it's good then to start implementing and integrating a personal well-being plan to incorporate into your management style. This could include having regular check-ins with your team, doing a quick temperature check before a meeting to understand what their energy levels are like, or encouraging flexible working arrangements or reasonable adjustments in the workplace, and maybe even modeling self-care behaviors as a very important one. Lastly, I would say start small. Don't let the pressure of being that perfectly well-being informed manager add more stress to your daily life. We're all human, and it's okay not to get it right the first time. However, I really firmly believe that a start in the right direction is vital. Thanks.
Thank you very much, Ruan, and thank you for a quote. I haven't heard that one before, but I really like this of giving the best of you instead of what's left of you. I don't know if I'm paraphrasing it correctly, but I think it really resonated with me what you had to say. And I think what I heard is this, there is a degree of intentionality to everything that we're going to do. It's like being conscious and conscientious about ourselves, and sometimes accepting the small things do make a big difference, as long as they're done kind of consciously and deliberately in the right direction, rather than kind of always aiming for big things and then beating ourselves down because we may not get it right the first time. So thank you very much. I think that was very insightful. Let me turn to my namesake, and I don't get to say this often, but Daniela, would you like to add something to what Ruan has said? Over to you.
Yeah, absolutely. Thank you. Indeed, I would like actually to stress again how important it is to be aware of your own reactions to stressful situation, right? And this is almost a journey, recognizing how you are reacting to stress, identifying the triggers, understanding the stress reactions, what are the warning signs, learning about the symptoms and how to manage them. All this it's a whole journey. But from my experience with managers, I actually understand that there is willingness actually to engage in such a journey, because there is understanding also that through good self-care they actually will be able to be even better managing their teams, and therefore they will also enjoy good reputation also, right? So it goes, I would say it goes even beyond simply the personal gain of managing your own stress in crisis situations, right? The other thing that I really wanted to stress is about the importance of recognizing own limitations, because of course as a manager you are very much looked at as people look at you for leadership, they look at you for example, but it's also important to recognize that you have limitations as a human being, and that displaying a certain level of vulnerability is not a weakness. In a crisis situation, actually, and this has been shown by a number of researchers in this area, team members relate more effectively with managers and leaders that show their human side, in addition, of course, to all their technical capacities and managerial practices. So showing a certain level of vulnerability, it's not a weakness. And I will conclude by saying that it's very important also to reach out for support. It is important to reach out for support, not only for yourself as manager, because then you will probably get support and be able to access a certain level of support, but it also shows to your team members that support is available within the organization. Then it's okay not to feel okay at some point during your career in the organization. So it's also about the manager validating the fact that everyone at some point might not feel okay and might need support from within the organization.
Thank you very much, Daniela. I think this really brings us a full circle from Ruan saying, reflecting inwards on our own mental health, and you adding to it to say that, you know, the displaying vulnerability is not a sign of weakness. As a matter of fact, I think it's a sign of strength, because you recognize it and you want to do better. And then the third point being reaching out for help, which is actually available. So I think that brought us really nicely. So I'm going to reach now back to Therese to wrap this up. Thank you very much.
Thank you, and thank you to all of you for your amazing insights. And obviously, there's a whole range of things we could cover on this topic, but I think the key messages that I was taking away for that is: do take action around your own health and well-being. Consider your needs, develop a plan, and make sure you enact that plan. And there's details on the fact sheets I mentioned earlier on how to develop a plan. So I do encourage you to have a look at those. Do be a role model. What you do has an impact on all of those that you work with. So we can all take a role, be a role model, and make sure we're encouraging others to look after their mental health and well-being at this time as well. And it's okay to be vulnerable. It's okay to not be okay. We're all not okay some of the time. But if you do need extra help, do reach out. There is a lot of extra support within the organisation, particularly with our staff counsellors and a whole range of other options. So recommend you follow us on our social media accounts for new information and updates, which is UN, capital UN, for the number 4 mental health. So UN for mental health. Also go to our website, which is www.un.org/en/healthy-workforce. So www.un.org/en/healthy-workforce. If you follow us on our social media and you haven't got all of those details, you'll be able to see the links to our website there. So thank you again to our amazing panelists today, Daniela and Ruan. Fantastic to have you on board, and we're so lucky to have experts such as you to guide us through this time. And to my co-facilitator, the other Daniela, thank you for your great questions and your great insights as well. I hope you've enjoyed this recording.
Thank you.
You were great.